Hello. This is the fourth video for chapter 17, which is on blood, but this video specifically is focusing on leukocytes, or our white blood cells. Leukocytes are the only formed element that is a complete cell. They have nuclei, they have organelles. They also make up about, less than 1% of the total blood volume. If you remember all the way back to that very first video, we talked about blood being centrifuged and then the buffy coat and how white blood cells are found in the buffy coat, and that accounts for less than 1%. And so that's where that comes from. There's about 4,800 to 10,800 white blood cells per microliter of blood. That would be considered pretty normal. They function in defense against disease. They can leave capillaries via diapedesis, which is like this kind of squeezing motion. And then they move through tissues by amoeboid motion and positive chemotaxis. So amoeboid motion is moving kind of like an amoeba. But if you don't know what an amoeba is, then that doesn't help you out. So what it is they have like these cytoplasmic kind of extensions that create these pseudopodia. Like the cytoplasm moves and creates these pseudopodia, which are called false feet. And they just kind of crawl along. And then positive chemotaxis means that something is attracted toward a chemical. Leukocytosis would be a white blood cell count over 11,000 per microliter. And this would be normal in response to an infection. And then leukocytes themselves are grouped into two major categories, granulocytes and agranulocytes. Granulocytes contain visible cytoplasmic granules. These are going to be neutrophils, eosinophils, and basophils. And then agranulocytes do not contain visible cytoplasmic granules. These are going to be lymphocytes and monocytes. And then somebody came up with a mnemonic to help you remember the abundance. It's decreasing in blood. So starting off with N, or never let monkeys eat bananas. The N would stand for neutrophils, so there's the most neutrophils and there are the least basophils. And that is what we see on this slide. So this slide, again, this is kind of like saying formed elements, and this is not to scale, not even remotely to scale. But we have the erythrocytes down here, then leukocytes would sit up on top. And then if we were to kind of open this up and look at this, we would see that the majority of white blood cells are neutrophils. And then next, we have lymphocytes, which are agranulocytes. Then we have monocytes, which are agranulocytes. Then eosinophils, which are granulocytes, and basophils, which are granulocytes. This is just an image of just histology of actual leukocytes. We can see neutrophils, eosinophils, and then basophils, again, are your granulocytes, and then your agranulocytes are the two on the right, the lymphocyte and the monocyte. I do not put pictures or images on my exams for lecture. Therefore, this is not something that's going to show up as an identification type question on an exam. All right, so granulocytes, three types. Again, neutrophils, eosinophils, and basophils. They are larger and shorter lived than red blood cells. They contain lobed rather than circular nuclei, and they are all phagocytic to some degree, which means that they will eat stuff. Neutrophils, again, the most numerous of the white blood cells, about twice the size of a red blood cell. And then the granules themselves contain either hydrolytic enzymes or antimicrobial proteins called defensins. And then the cell has anywhere from 3 to 6 lobes. It's also called apolymorphonuclear leukocytes, or PMN, or polys. And again, that's just because it has 3 to 6 lobes. The cell does. Neutrophils are very phagocytic. They're called bacterial slayers. They actually kill microbes by a process called respiratory burst. And this is when the neutrophil synthesizes these real potent oxidizing substances like bleach or hydrogen peroxide. And then remember, the granules contain defensin. So the defensin granules merge with the phagosome, and then they form these spears that pierce holes in the membrane of the ingested microbe, which is probably a bacterial cell. It could be something else, but. And then these are your neutrophils, and you can see the number of lobes present, all the lobes. Then we have eosinophils. These are going to account for 2 to 4% of all leukocytes. The nucleus has 2 lobes, and it ends up looking like earmuffs to a degree. The red staining granules contain digestive enzymes, which will be released on large parasitic worms, and it'll digest their surface. They also play a role in asthma and allergies, as well as immune response modulators. And these are your eosinophils, or that is an eosinophil. And then basophils. These are the rarest of white blood cells, accounting for less than or up to 1% of leukocytes. The large purplish black granules contain histamine. And histamine is an inflammatory chemical that acts as a vasodilator and attracts white blood cells to inflamed sites. They are functionally similar to mast cells. So mast cells also release histamine. And this is a basophil. And then we have agranulocytes. These are going to lack visible cytoplasmic granules. There are two types, lymphocytes and monocytes. Both have spherical or kidney-shaped nuclei. So the second most numerous white blood cell is the lymphocyte. Large, dark purple, circular nuclei with a thin rim of blue cytoplasm. They're mostly found in lymphoid tissue, like lymph nodes or the spleen. However, some may be found in the blood itself. They are crucial to immunity, and there are 2 types. There are T lymphocytes or T cells, and B lymphocytes or B cells. And we are definitely going to talk about these in way more detail whenever we get to the chapter on the immune system. But just kind of general, T cells are going to act against virus-infected cells and tumor cells. And then B cells are going to give rise to plasma cells, which are going to produce antibodies. And that's an example of a lymphocyte. And then finally, we have the monocytes. These are the largest of all white blood cells. They have a U or kidney-shaped nuclei. They do leave circulation in inner tissues, and when they do that, they differentiate into macrophages. And macrophages are actively phagocytic cells, and so are monocytes once they convert to a macrophage. They are crucial against viruses, intracellular bacterial parasites, and chronic infections. In addition, they also activate lymphocytes to mount an immune response. Something that we will talk about again more when we get to the immune section or the immune system chapter is that T cells and B cells oftentimes have to have the antigen literally presented to them before they do anything. So, and macrophages play a big role in as antigen presenting cells, which are the cells that present the antigen. So that would be a monocyte. And then all 5 of them again. And then we have leukopoiesis, which is the production of white blood cells. And it's going to be stimulated by 2 types of chemical messengers from red bone marrow and mature white blood cells. One is interleukin, or interleukins, and they are numbered. So you may be talking about interleukin 3 or interleukin 5. And then there's also colony stimulating factors. And these are going to be named for the white blood cell that they stimulate. So there's granulocyte colony stimulating factor, which stimulates granulocytes. All leukocytes originate from hemocytoblast stem cell that branches into two pathways. So you have the lymphoid stem cells and the myeloid stem cells. The lymphoid are going to produce the lymphocytes, the myeloid are going to produce everything else, all the other elements. Agranulocyte production. So monocytes, again, they are the myeloid line, share a common precursor with neutrophils. They can live for several months. And then we have the lymphocyte, which is derived from the lymphoid line. And as I'm sure you can imagine, T lymphocyte precursors give rise to immature T lymphocytes. And T lymphocytes mature in the thymus. And then we have B lymphocyte precursors, which give rise to immature B lymphocytes, which will mature in the bone marrow. If you're having problems remembering that, T lymphocyte matures in the thymus, which starts with a T, and B lymphocyte matures in the bone marrow, which starts with a B. And then lymphocytes themselves can live anywhere from a few hours to decades. I am not going to ask you to memorize this, not in the least. I just want you to know that the two lines exist. One is going to create lymphocytes. The other one is going to create all the rest, all the other white blood cells. And yeah. All right. So then we have leukocyte disorders. An overproduction of abnormal white blood cells would be leukemias or infectious mononucleosis. And then an abnormally low white blood cell count is leukopenia. And this can be induced by drugs, particularly anti-cancer drugs or glucocorticoids. Leukemias are cancerous conditions involving overproduction of abnormal white blood cells. They usually involve clones of single abnormal cells, and then they're named according to the abnormal white blood cell clone involved. So myeloid leukemia involves myeloblast descendants, and lymphocytic leukemia involves lymphocytes. And then we have acute and chronic leukemias. So acute are quickly advancing. Leukemias are derived from stem cells. And these types of leukemias primarily affect children. And then there's the chronic, or the slowly advancing leukemia. And this is going to involve proliferation of later cell stages, and this is going to be more prevalent in older people. Without treatment, all leukemias are fatal. What happens is immature, non-functional white blood cells flood the bloodstream, and then cancerous cells will fill the bone marrow, crowding out other cell lines. This is also going to affect erythropoiesis and affect platelets being formed as well, which means that it would also lead to anemia and bleeding. And I know we haven't talked about platelets yet, but platelets are going to help stop bleeding. Again, we'll get into more detail a little bit later. And then death is usually from internal hemorrhage or overwhelming infections. And then treatment would be irradiation, leukemic drugs, or stem cell transplants. Infectious mononucleosis, or mono is what most people call it, or the kissing disease, is a highly contagious viral disease typically seen in young adults like high schoolers, maybe even maybe college, but I mean, that was something more, I think, that I saw in high school. Caused by Epstein-Barr virus and results in high numbers of typical agranulocytes. I think that's actually supposed to say atypical agranulocytes. But anyway, because what happens is the lymphocytes become enlarged. And in fact, they originally thought that those enlarged lymphocytes were monocytes, so they named the disease mononucleosis. And then the symptoms include tired, achy, chronic sore throat, low fever, and then it runs this course in like 4 to 6 weeks. And then finally, platelets. Platelets are fragments of a larger megakaryocyte, and it's blue staining outer region, purple granules, and they contain several chemicals involved in the clotting process. For example, serotonin, calcium, enzymes, ADP, platelet-derived growth factor. And I know you don't know where any of these play a role quite yet, but we're going to get to that in the next video, actually. And their function is to form temporary platelet plug that helps seal breaks in blood vessels. And then circulating platelets are actually kept inactive and mobile by nitric oxide and prostacyclin that is being secreted from the endothelial cells that are lining the blood vessels. Platelet formation is regulated by thrombopoietin. And it forms, okay, so here's the deal. I really want you guys to understand how platelets are formed, but I don't need you to memorize this whole screen. So I just really want you to understand that what happens is we start from this megakaryoblast, okay? Mitosis occurs, but no cytokinesis, so it just gets really big, okay? And resulting in a stage 4 cell, okay? So it's a nice stage 4 cell. It's going to be big. And then the stage 4 cell sends out these little cytoplasmic projections into the lumen of the capillary. The projections break off into platelet fragments, and that's it. And platelets age quickly, degenerate in about 10 days. Normal is about 150,000 to 400,000 platelets per mil of blood. That's what this is showing. We start off with a stem cell. Sorry about that, guys. We start off with a stem cell, and then we have this stage 1. It gets bigger and bigger, and then the cytoplasmic projections break off, and we have platelets. This right here is a table of all the different formed elements of the blood and their description, the duration of development, their function. You're welcome to go through this. If it wasn't covered in the lecture, then it's not something you need to know. Here are your questions. That's all I've got for you.